This video will discuss about carbohydrate metabolism disorders. Carbohydrate metabolism disorders are a group of metabolic disorders. It is a group of metabolic disorders which occur due to deficiency or complete absence of certain enzymes. So, it is a group of metabolic disorder which occur due to deficiency or complete absence of some enzymes that helps in carbohydrate metabolism. That enzyme help for carbohydrate metabolism. The main causes is mutation in genes coding for the enzyme. Here the mutation in genes coding for the enzyme. So it is a group of metabolic disorders which occur due to deficiency or complete absence of some enzyme. It causes because of mutation in gene coding. Some of the disorders of glucose metabolisms. What are the disorders? Glycogen storage diseases, pyruvate kinase deficiency, pyruvate dehydrogenase deficiency, glucose 6-phosphate dehydrogenase deficiency, and diabetes mellitus. So, these are the example of disorders of glucose metabolism: glycogen storage disease, pyruvate kinase deficiency, pyruvate dehydrogenase deficiency, glucose 6-phosphate dehydrogenase deficiency, and diabetes mellitus. First, we want to discuss glycogen storage disease, GSD. Glycogen storage disease. These are the conditions which occur due to defect in glycogen synthesis. Due to defect in glycogen synthesis or breakdown within the muscle and liver cells. Breakdown within the muscles and liver cells due to deficiency of particular enzyme. There are 10 different types of glycogen storage disease, out of which few are discussed below. Important only we want to discuss. First one is glycogen storage disease type 1. Type 1 glycogen storage disease, it also called as von Gierke disease. It is an autosomal recessive disorder. Autosomal recessive disorder caused by mutation of glucose 6-phosphatase gene. Okay, here disorder caused by mutation of glucose 6-phosphatase gene. The gene located on chromosome number 17. This causes deficiency of this enzyme glucose 6-phosphatase. That enzyme need for glycogenolysis. This one mainly infect infant at the age of 3 to 6 months. Usually seen in infant at the age of 3 to 6 months. This condition causes glycogen accumulation in the liver and kidney. In this condition, glycogen accumulate in liver and kidney. The sign and symptoms include hepatomegaly, then hypoglycemia, ketonuria, lactic acidosis, failure to thrive. Glycogen also get deposited in the kidney. An enzyme assay and liver biopsy. For diagnosis, we are using two types of test: enzyme assay method and liver biopsy. Treatment for type 1 glycogen storage disease. Avoidance of fasting for more than 3 to 4 hours. Adequate diet therapy. And avoid use of excessive fructose and lactose, which are metabolized by glucose 6 phosphatase in liver. Adequate diet therapy. Second, type 2 glycogen storage disease, also called as Pompe disease. It is a rare autosomal recessive metabolic disorder. Rare autosomal recessive metabolic disorder resulting from mutation in the acid alpha glucosidase. Mutation in acid alpha glucosidase gene presented on chromosome number 17q25. So this one mutation of acid alpha glucosidase GAA gene presented on chromosome 17q25, coding for the enzyme acid alpha glucosidase, which help in breaking glycogen. This result in deposition of glycogen in tissue like muscles and nerves. The symptoms are seen in infant and later childhood. Signs and symptoms include weak muscles, feeding problems, hepatomegaly, failure to gain weight, breathing problem, enlarged heart, then difficult in walking, high level of creatine kinase. Diagnosis is done by enzyme assay method, pulmonary function test, electromyography, MRI, X-ray and sleep studies. Next one is type 3 glycogen storage disease, also called as Cori disease or Forbes disease. It is an autosomal recessive metabolic disorder resulting from mutation of amylo alpha 1,6 glucosidase. Mutation of amylo alpha 1,6 glucosidase, alpha 4 gluconotransferase gene, AGL gene, alpha 4 gluconotransferase gene located in the chromosome 1p21, coding for the glycogen debrancher enzyme, AGL, needed in glycogenolysis. This result in buildup of abnormal glycogen in the cell, especially in muscles and liver. Signs and symptoms include slow growth, muscle weakness, hypotonia, mild myopathy, weak heart muscles, hypoglycemia, hyperlipidemia, then elevated level of liver enzymes, hepatomegaly, cirrhosis and liver failure in severe condition. So, slow growth, muscle weakness, mild myopathy, weak heart muscle, hypoglycemia, hyperlipidemia, elevated level of liver enzyme, hepatomegaly, cirrhosis and liver failure in severe condition. A diagnosis is done by enzyme assay. Elevated level of transaminase, creatine kinase, then biopsy of liver. To this biopsy of liver to measure deep branching enzyme activity or muscles, ultrasound, DNA mutation analysis, genetic testing for AGL gene. Treatment include high protein diet to initiate gluconeogenesis, then adequate diet therapy, liver transplantation in severe cases. So what are the diet? In high protein diet, adequate diet therapy, then liver transplantation for severe cases. Next, type 4 glycogen storage disease. This one also called as Andersen disease. Andersen disease. It is an autosomal recessive metabolic disorder resulting from mutation of glycogen branching enzyme 1 gene. Glycogen branching enzyme 1 gene. GBE1 gene coding for glycogen branching enzyme which is needed for normal glycogen production. This result in accumulation of amylopectin, a polysaccharide in the tissue, especially of liver and muscles. The symptoms are the evident in the first few months of life. The signs and symptoms include decreased growth rate, hepatosplenomegaly, failure to thrive, cirrhosis of liver, esophageal varices which may rupture resulting in coughing up of blood, muscle weakness, fatigue, cardiomyopathy, difficult in breathing, muscles wasting, feeding difficulty, lack of appetite, failure to thrive, and sometimes neurological involvement. Then diagnosis is done by biopsy of tissue like liver, skeletal muscles, nerve cell, skin cell, liver function test, blood glucose studies, CD scan, liver function test, blood glucose studies, then CD scan, MRI scan, electromyography, echocardiography. Treatment to maintain blood sugar level, high protein diet, medication, and surgical intervention to treat heart failure and liver transplantation. Next, type 5 glycogen storage disease. McArdle disease, also called as McArdle disease. It is an autosomal recessive metabolic disorder due to mutation of PYGM gene located on chromosome number 11, which code for the enzyme presented in muscles, glycogen phosphorylase enzyme. Enzyme here, glycogen phosphorylase. It have another name, myophosphorylase, resulting inability to break down glycogen. This condition causes failure and muscle pain during exercise. Failure and muscles pain during exercise. Permanent weakness in the thigh. Permanent weakness in thigh and other muscles. Then brownish red urine, especially after that activity. Most of the symptoms are seen before 15 years of age. Diagnosis is done by blood testing for muscle enzyme such as creatine kinase, electromyography to measure electrical activity of muscles, MRI studies of muscles, urine test for myoglobin which make the urine dark, muscle biopsy which shows buildup of glycogen and absence of muscle phosphorylase. Patient should be advised to avoid intense exercise but can do moderate aerobic exercises. Creatine and vitamin B6 supplement. Creatine and vitamin B6 supplement. Diet rich in protein. Diet rich in protein. Medicine like angiotensin covering enzyme inhibitor can be used. Angiotensin converting enzyme inhibitor can be used. Type 7 glycogen storage disease. It is an autosomal recessive metabolic disorder due to mutation of gene coding for enzyme. Here enzyme names phosphofructokinase. Phosphofructokinase, it directly affected that glycolysis. It affect glycolysis as it failed to phosphorylate fructose 6 phosphate to fructose 1,6 bisphosphate. So this one fructose 6 phosphate cannot converted into fructose 1,6 bisphosphate. This prevent the formation of ATP from ADP, resulting in lack of ability to provide energy to the muscles during exercise. Here fructose 6 phosphate cannot converted into fructose 1,6 bisphosphate. So it prevent that formation of adenosine triphosphate from adenosine diphosphate. So resulting in lack of ability to provide energy to the muscle during exercise. Phosphofructokinase is a tetrameric enzyme, consists of 3 subunits. It is a tetrameric enzyme. It having 3 subunits. PFKL liver, PFKM muscles, PFKP platelet. Disease, M subunit of this enzyme is defective. It directly affects glycolysis and it is difficult for muscle cells to use glucose for energy. So it directly affected glycolysis. So it is difficult for muscle cells to use glucose for their energy. Sign and symptoms: weakness, pain and stiffness during exercise, sometimes associated with nausea and vomiting and dark colored urine due to presence of myoglobin. Destruction of muscle tissue can also occur. Diagnosis: muscle biopsy, blood test to measure activity of phosphofructokinase, creatine kinase, then genetic testing. Finally, treatment: avoid carbohydrate, follow ketogenic diet, then enzyme replacement therapy. Avoid carbohydrate, ketogenic diet, then enzyme replacement therapies.